Okay, so today I'm going to talk about HIV prevention. Just again, another little whistle-stop tour of the most common ways for HIV prevention, and then a little bit about what we do here in Wakefield. I'm doing these Zoom sessions, lunchtime sessions, as part of National Sexual Health Week. So, starting off, HIV, why is this still something that we are interested in and talking about? So today we're going to look at prevention with condoms, PrEP, PEP, TASP, which stands for treatment as prevention, and regular testing. And then I'm going to explain a little bit about what we do as a service. So just thinking about what HIV is again, it stands for human immunodeficiency virus. So HIV is a virus that humans can contract, which attacks the immune system and makes it not work as it should. When you think of HIV, you might think of one of these 4 images here that represents just the virus itself, men who have sex with men, or gay and bisexual men, African communities, and then also AIDS. And thinking about how these represent the HIV community in the UK. But HIV is all of those things, and it is much more than that. Yes, it is simply a virus, but it is wrapped in stigma and discrimination, and it's a virus that can be very damaging when left untreated. And if you have HIV in all genders, sexualities, and in all countries of the world, so it's not limited to one area or one type of person. So why are we focusing on prevention? Why do we still need it? You know, one of the conversations I hear about HIV is that, oh, is that still a thing? And I'm here to say, well, it very much is still a thing. I've got a few little statistics here to just sort of show you how HIV has affected the world over the years. And there's a lot of numbers here, but I'm just going to try and break it down. So we have about 40 million people have died from AIDS-related illnesses since the start of the epidemic. And we have about 38.4 million who are living with HIV currently, and 1.5 million across the world who have been newly infected with HIV in 2021. So it is still something that is being passed around and affecting many people around the world. And that point number 4 there, we still have 650,000 people dying from AIDS-related illnesses in 2021. Now that number does fall each year. I remember looking at the statistics for 2020, and it was about 900,000. And each year it gets a little bit less. But we know at BHA that HIV is a completely preventable and treatable illness. So there's no reason for these numbers of people to be dying from something, you know, like I said, it's preventable and treatable. In the UK, is a little bit more of a UK picture. We had about 2,955 people diagnosed in 2021, which is an overall fallen from 2020, but there has been a slight rise in England. What's most interesting about this figure is that we have 46% of that 2,955 who were diagnosed late. A late diagnosis, I've put there the problems that you can get from a late diagnosis. It increases risk of early mortality by eightfold, and it causes big impacts on quality of life and the increase of onward transmission if you're diagnosed late. So we work to prevent HIV transmissions and also make sure that people are tested regularly so that if they have acquired HIV, they can be treated and it won't damage their body. So first bit about HIV prevention, I'm going to talk about is condoms. It's probably the most well-known way of preventing HIV. When HIV was first recognized as, when it was first recognised how HIV was transmitted between people, it was one of the first things that was put into place. Condoms create a physical barrier, whether you're using an external condom, like on the picture in purple there, or an internal one, sometimes called a male or female condom. And they both work because it's essentially a barrier method which stops those sexual fluids from being exchanged, and therefore the HIV from being exchanged. Technically, it should be 100% effective because there's an actual physical barrier. However, it's more like close to about 80% effective, because a lot of people don't use condoms correctly, or they don't find the right condom for them. And so we offer condom sessions with community groups, and we show people again how to use condoms, how to put them on, how to know when something fits, what to check for, because we find a lot of people might have had, if you were had your education in the UK, you might have had one lesson one time when you were about 13 or 14 about how to put a condom on, and then it's never really discussed again. We find that a lot of people don't talk about these things with their friends or with their parents talking about it, or a guardian. So we offer these sessions out in the community to just remind people what to look for. Obviously, a condom has the added benefit of protecting you against other STIs and pregnancy as well. We have a free condom service. We offer condoms to all sort of vulnerable communities in Wakefield. So anyone who might have difficulty accessing, being able to buy a condom from a shop, or accessing the sexual health services, whether you give them for free. We can order all of these different types of condoms that you can see down there below. You can request them there on the condom request. You can scan that QR code and order condoms, postal condoms. We also drop them off at community venues, such as pubs and bars, with some barbershops and hairdressers, and at asylum seeker sites and food banks as well. Next, HIV prevention tool we call PrEP. PrEP stands for pre-exposure prophylaxis. It is a preventative medication. So different to the condoms, which is a barrier method, this is a medication that people can take. PrEP is probably one of the best tools we have worldwide for stopping HIV transmission. In the UK, we hope to get to 0 transmissions by 2030. And good use of PrEP is going to be one of the key factors in achieving that. The drugs, themselves, it's a combined medication of 2 drugs. They're commonly used to treat HIV as well, 2 of the drugs. And commonly, Truvada is the most well-known name. But in the UK, the NHS uses generic medication. It's the same drug, but it made more widely. Think of the differences between something like ibuprofen and Nurofen. Nurofen is the brand name, ibuprofen is the drug. And so the same here, Truvada is the brand name, but the drug itself is tenofovir, and I can't even say that one, trisabine. So we have different PrEP delivery methods. Currently, it is the pill form, but research has been done into injectable PrEP, which should be available soon. And we're looking at implants, and vaginal rings will be available soon as well. So these different delivery methods open it up to different audiences. Research was done recently among Black African communities, and although they were more unlikely to take the pill form of PrEP, they were more likely to take injectable PrEP or implants, which just proves why this research, is still vital. It is available for free on the NHS in England, and you can access it at sexual health clinics if you are interested in PrEP. PrEP can be taken in 2 different ways. Once a day, regularly, or sometimes called on-demand or event-based dosing. The little graphic there shows how someone might take it for event-based dosing. 2 pills, 2 to 24 hours before you plan on having sex, and then 1 pill for the first 24 hours, and then another pill 48 hours afterwards as well. It's very effective, whether it's event-based or daily-based, though the event-based has only been studied in gay and bisexual and men, so it's not known exactly how effective that would be on women or the people with vaginas. Daily dosing is still recommended for women to protect against HIV. And as we've got, it says on the bottom there, all trans people are recommended for daily PrEP treatment, or anybody who is on hormone treatment, as there isn't the data to see how it would work and how effective it is on people taking hormone treatment. But it is available, like I said, to everyone, and a really, really good tool that we have in our toolkit for preventing HIV transmissions. Next, we have PEP, and there's a lot of information here, but PEP is a combination of drugs which can stop the virus from taking hold in somebody's body. It's to be taken, so PrEP stands for pre-exposure, PEP stands for post-exposure. It should be taken within 72 hours, but ideally within 24 hours after the risk took place. Most people would access PEP because of a potential sexual transmission. If this has happened to you and you're sort of unknown whether you think you might have been exposed to HIV, you can go to sexual health clinics or A&E, and they will screen you to see whether PEP would be for you or not. They'll ask you these questions about the person you've had sex with, what sort of sex you had, if the other person has HIV or not, whether you know that they had HIV or not, and what their viral load was. Because if that person was HIV positive and undetectable, there's no risk of HIV transmission, so they wouldn't prescribe somebody PEP in that instance. It's not, it is quite not harsh form of medication, but it is a long course of medication that somebody has to take for 28 days. It's not 100% guaranteed to work, and it is a last resort. You'll often find people using PEP after maybe needle stick injuries as well, or in instances of sexual assault and rape, potentially. And places like rape crisis centres often have links to be able to access PEP as well. In order to take it, you do have to be quite strict with your regime, not skipping doses and making sure it's taken for the 28 days that is suggested. The pill name there, you might recognise a Truvada, which is similar to PrEP, and raltegravir is a HIV drug that people take who are living with HIV, and this will prevent it from taking hold in someone's body. There are a few side effects such as nausea, headaches and tiredness, which people have talked about getting after it. And there are warnings as to not take recreational drugs while on PEP because it can have interactions which would mean it wouldn't work. And you can take PEP if you are breastfeeding or pregnant. It is safe to take, in those circumstances. It's again another great tool that we have, but it is a last resort and an emergency. And the pre-exposure and the barrier methods for condoms are much better than using PEP. As I said, it should only be as a last resort. We recently had some data released about HIV testing and PrEP. And these are some little infographics from the National AIDS Trust, and I've put that statistic there about people being diagnosed late. because one of the things that we're working towards is the uptake of PrEP in communities that are not gay and bisexual and men who have sex with men. Because you can see there, only 1 out of 3 of heterosexual and bisexual women who might need PrEP were assessed for it, and only half of heterosexual men who might be eligible for PrEP were offered assessment for it. And I think it would be, it's really important that, all communities have access to the proper information about PrEP and are offered, at these vital services. But part of that is understanding and knowing about it and getting people talking about PrEP, and knowing what it is and why we're using it. Another key prevention tool we have is regular testing. The best way we can stop onward HIV transmissions is testing people and finding out who is living with HIV. Everyone should have a HIV test at some point, regardless of circumstances or sexual orientation. Everyone should know whether they are living with it or not, because HIV can go and stay in your body unknowing for some people up to years, and that can potentially mean forward transmissions and then also damaging to your own health as well. It's recommended that those who are sexually active with different partners should have a test a minimum of every 3 months. Places you can test in Wakefield, you can test at Spectrum Wakefield Integrated Sexual Health, or WISH for short, which is located on Trinity Walk. We test at various community venues, BHA Wakefield, I've listed a few of them there. You can always drop into our office or book online for a test in our office spaces, which are in Beach House on Margaret Street in central Wakefield near the college. You can also ask for tests at a GP surgery, and you can ask for tests at A&E as well, and other emergency walk-in clinics often have provisions for testing. How it's done, how the tests are done. So I've got some little pictures there on the right, and these are the tests that we use. They're called Insti tests. Very quick and very easy to do. But if you were going to A&E or hospital-based testing or GP surgery, you'll probably have a venous blood test. Healthcare worker will take a sample, and the sample will be sent off to a lab, and it will be back with you for 1 to 2 days or up to a week, similar to any other blood test that you might have done. It wouldn't appear any different at all. So the community testing that we do, and that other services do, we do a rapid finger prick blood test, like demonstrated on the picture on the bottom right there. These rapid blood tests can be done at home. So if somebody had the means to buy a test, you can buy them from places like Superdrug and Boots. And they can take anything from a few seconds to develop to under 15 to about 15 minutes. The test that we use is ready in about 30 seconds to a minute. So people get that result instantly. The thing with our tests, though, unlike the venous blood tests, our tests are testing for the antibodies that your body creates to, say, fight off and manage the HIV in there. And these can take up to 12 weeks to develop in the body. So when we are offering someone a test, we will ask about this window period, because if somebody came into us and were concerned about sex that they had 2 weeks ago, we would explain to them about the window period and that it can take up to 12 weeks for HIV to be shown up on this test. For a venous blood test, it's looking for viral load, not for the antibodies. So if it's looking for the virus itself, around 4 weeks is about the earliest time. 3 to 4 weeks is the earliest time that can be detected in the body. So based on your worry, your concern, your sexual interactions, it might influence the choice you make on which test you have. If somebody comes to us and wants that test, say, like the example I used earlier from 2 weeks before, we would test them, and then we would also book them in again within that window, at the end of that window period time, to double check and make sure you know, that they so to put their mind at ease most of the time. Another prevention method we've got here is TASP, or treatment as prevention. So people, this is for people who are tested and know that they're living with HIV. It's called antiretroviral therapy, or ART, or ARVs. It's a combination of 3 drugs, very similar to the PEP. And for most people living with HIV, it's 1 pill a day. Some people might have it in 2 or 3 separate pills. Once somebody is on this medication, the reason why it's prevention is because when they're on this medication, their virus will become so suppressed in their body, it becomes undetectable, which means they cannot pass that virus on to their sexual partners. And there's an extremely low risk of passing it on to children. I think it's something like 0.1% chance. So it is, again, another amazing tool that we have to stop the spread of HIV. The majority of people, 98% of those who are known to be living with HIV in the UK, are on this treatment and are undetectable. This treatment is being offered as long-lasting injectable medication from this year, which is administered once a month or every other month at their local clinic. And whether it's once a month or every other month, that's dependent on the person. And much like PrEP, there are several different delivery methods in research. Same as PrEP, the implant and the vaginal ring available as HIV treatment, or will be available, excuse me, they're not available right now, will be available in the future. They're being researched at the moment. Just to say a little bit more about this U equals U, this undetectable equals untransmittable. The statement was given officially in 2017 by the British HIV Association chair. This is also the same time that the NHS was allowed to tell their patients about this research. The main research which proves U equals U to be true is called the Partner Study 1 and the Partner Study 2. So if you're someone who would like to read the research, it is available online. If you can Google the Partner Study 1 and 2 HIV, and you'll find their findings. The Partner Study 1 and 2 logged hundreds of thousands of sexual interactions between serodiscordant couples, which means one person living with HIV and on treatment, and one person HIV negative. They logged, like I said, hundreds of thousands of interactions, and there were no HIV transmissions. There has never been a recorded HIV transmission from someone undetectable to a HIV negative person. So we can be pretty sure of the science here, and that's why it is one of the key prevention tools that we have out there. So a little bit about what we do here. So at BHA Wakefield, we not only work in HIV prevention, we also offer support to those already living with HIV. We offer different types of support: one-to-one support, support groups and peer support, specialist counselling. And in our prevention, we offer one-to-one PrEP and HIV support with vulnerable people. So if people are having trouble understanding what PrEP is, the benefits of it, or would like to talk to somebody who has taken PrEP, so they would know what, what it feels like and what it's like, we can offer those sessions to people. We offer group HIV and STI prevention sessions with community groups, and then we also do general HIV knowledge and awareness training for either clients or community groups as well. Some things that you can do to promote sort of HIV prevention in your services or with friends and family in your community you know, talking about HIV prevention, challenging misinformation and jokes about HIV, normalizing testing, you know, have a test, you know, see what it's like, talk about it with your friends, talk about it with your family, with your children, you know, let's normalize testing. Historically, people have been extremely fearful even to have a HIV test, and it's one of the reasons why those people are diagnosed so late, because there's often such fear just around testing itself, when actually it's a very, very quick, very easy procedure to do. And we have literature available, which we can either email to you to print off or drop off and bring around Wakefield for you about HIV, about PrEP, about testing, about U equals U, and whatever you want, really. And have our information visible. You know, again, we can send posters or leaflets for you to print off yourself, or we can drop things off. And we are working to support opt-out testing in A&E and other emergency clinics. Similarly to the blanket screening that all pregnant mums have, opt-out testing has been proven to work in cities like London, and Leeds offer opt-out testing as well, and it's been working in Manchester. And we've found hundreds of people living with HIV who are either unknown or lost to care through this opt-out testing service. So we'd love that to be in all areas of the country, not just in a few cities. We do have a YouTube channel which is filled with lots of different videos to do with PrEP and PEP and HIV prevention and the other work that BHA do across their sites in Liverpool, Manchester and Leeds. I do have a feedback form which I will pop into the chat as well. I'd be very grateful if you could fill that in, or you can scan the QR code and it'll take you straight there. If you're interested in having a training with me, or any more information or any questions that you forget about or you would like to ask, you can contact me on my email address or my phone number there. So thank you very much for listening, and I'll take any questions that you might have.
Thank you for that. I don't think I've got any questions, but that was really interesting.